Welcome to Lesson 3 of the First Aid, CPR, and AED unit. In this lesson, we'll cover heart attacks, cardiac arrest, and stroke, which are some of the main causes for administering CPR. Cardiac emergencies are life-threatening. Two of the most common cardiac emergencies are heart attack and cardiac arrest. And typically what causes those things is cardiovascular disease. It's the leading cause of a lot of cardiac emergencies. It is an abnormal condition that affects the heart and blood vessels and remains the #1 killer in the United States and a major cause of disability. Before we get into different cardiac emergencies, I do want to go over how the circular system works, since that is the main player in a lot of cardiovascular diseases. The circulatory system consists of the heart, blood vessels, and blood. It is similar to that of a city water system because both consist of a pump, like the heart, a network of pipes, which are the blood vessels, and fluid, or the blood. After blood picks up oxygen in the lungs, it goes to the heart, which pumps oxygenated blood to the rest of the body. The heart is about the size of your fist. It's located in the chest between the lungs, and the cells of the body absorb oxygen and nutrients from the blood that it pumps and produces waste products, including carbon dioxide, that blood carries back to the lungs to be expelled from the body. In the lungs, the blood exchanges the carbon dioxide for more oxygen. Then, blood returns to the heart to be pumped out again. The human heart consists of 4 chambers, 2 on the patient's right and 2 on the patient's left. Each upper chamber is called an atrium. The right atrium receives blood from the veins of the body, whereas the left atrium receives highly oxygenated bloods from the lungs. The bottom 2 chambers are called ventricles. The right ventricle pumps deoxygenated blood to the lungs, and the left ventricle pumps highly oxygenated blood throughout the body. The most muscular chamber of the heart is the left ventricle because it needs the most power to force blood to all parts of the body. One-way valves located in the heart and veins allow the blood to flow in only one direction, so it never goes in an opposite direction, it only flows in one direction. Arteries carry blood away from the heart at high pressure and are therefore thick-walled. The main artery carrying blood away is very large, about 1 inch in diameter, which doesn't seem that large, but for arteries, that is very large. But the arteries do become smaller farther away from the heart, such as the legs, the arms, and the fingers and the feet. There are 4 major arteries in the body: the neck, also known as the carotid arteries, in the wrists, or the radial arteries, in the arm, which is the brachial arteries, and the groin, which is the femoral arteries. These 4 major arteries are what we use to measure someone's pulse. So if you think of someone, putting those 2 fingers on someone's neck, you're measuring the pulse in the carotid arteries. You could do the same on someone's wrist, which you are probably also familiar with, but you can also find these pulses in the arm and the groin area. Veins are thin-walled and carry blood back to the heart. So arteries carry blood away from the heart and are thick. Veins are thin and carry blood back to the heart. There are 4 components of blood. Plasma is the largest part of your blood. When separated from the rest of your blood, or the rest of its components, it is a straw-colored fluid, and its main role is to take nutrients, hormones, and proteins to the parts of the body that need it for different body functions. Your blood also contains red blood cells, which carry oxygen from the lungs to the rest of the body and brings carbon dioxide back to the lungs, ready for reoxygenation. White blood cells devour bacteria and other disease-causing organisms, so they are part of that lymphatic system that help fight off diseases and viruses. And lastly, there are platelets. Platelets are responsible for starting that blood clotting process when, for example, you get cut. Cardiovascular disease causes coronary heart disease, also known as coronary artery disease. Coronary artery disease occurs when the coronary arteries, which are those arteries that supply blood to the heart muscle, harden and narrow in a process called atherosclerosis. This damage occurs gradually as cholesterol and fatty deposits called plaque build up on the inner artery walls, which we can see in this image in the bottom right-hand corner of the screen. As that buildup worsens, the arteries become narrower and narrower, which reduces the amount of blood that can flow through those arteries and prevents the heart from getting the blood and the oxygen that it needs to pump. If the heart does not get enough blood containing that oxygen, it will not work properly. And that's what causes some of these other cardiac emergencies. Angina pectoris, or angina, is chest pain that comes and goes at different times. So we're not quite at that heart attack stage, but this is often a symptom or a sign that a heart attack may be approaching. Often this is simply called angina, and it develops when the heart needs more oxygen than it is getting due to a narrowing of the coronary arteries. When the coronary arteries are narrow and the heart needs more oxygen, heart muscle tissues may not get enough of that oxygen, and that's why that person starts to experience that pain. Pain associated with angina seldomly lasts longer than 3 to 5 minutes at a time, and a person who knows that they have a history of angina may have a medication prescribed to them, such as nitroglycerin, to temporarily widen the arteries and therefore help to relieve the pain. Most people with angina are advised by their doctor to take 3 nitroglycerin doses over a 10-minute period if they are experiencing pain or discomfort. However, some doctors do prescribe nitroglycerin differently. But since the areas that are narrowing can be the focus for clot formation and therefore causing a heart attack because that artery is now totally blocked by that clot, we do need to pay attention to how long angina pain does last. If that person's typical pain of angina lasts longer than usual, we do want to call 911 or the designated emergency number because it may be that angina has progressed to a heart attack. Heart attacks result when one or more of the coronary arteries is completely blocked, which we see in that last part of that image on the bottom left-hand corner of the screen. There are 2 primary causes for that blockage. The first is severe atherosclerosis. So if enough fatty deposits and cholesterol has deposited on the artery walls, it can completely block that, as well as a blood clot from somewhere else in the circulatory system that has broken free and become lodged in the artery, which we see in that image. If one of the coronary arteries becomes completely blocked, the part of the heart muscle served by that artery is deprived of oxygen and dies, which causes permanent damage to the heart. So, seeking advanced medical care as soon as the signs and symptoms of a heart attack are recognized can help to minimize damage to the heart and may save that person's life. Individuals may experience heart attack signs and symptoms differently, and not everyone will have every sign or symptom. Even people who have had a heart attack before may not experience the same signs and symptoms if they have a second heart attack. While males often have the classic signs and symptoms of a heart attack, like chest pain that radiates down one arm, females often have more subtle signs and symptoms. So heart attacks do typically present differently in females than males. In females, chest pain or discomfort might be milder and or accompanied by more general signs and symptoms like shortness of breath, nausea, or vomiting, including extreme fatigue and dizziness or lightheadedness. Because these signs and symptoms are so general and nonspecific, females may experience them for hours, days, or even weeks leading up to a heart attack, but dismiss them as nothing out of the ordinary. Signs and symptoms of a heart attack may also be subtler in people with certain medical conditions, such as diabetes. But those general signs and symptoms of a heart attack to look out for include pressure or tightness in the chest, pain in the chest, back, jaw, or other areas of the upper body that lasts more than a few minutes or that go away and come back, shortness of breath or difficulty breathing, sweating, nausea and an upset stomach, or weakness. Watch this video for more signs and symptoms of a heart attack. Many people who are experiencing signs and symptoms of a heart attack wait too long to get advanced medical care. What do you think are some reasons someone might delay seeking medical attention when they are experiencing those signs and symptoms of a heart attack? Some answers to this question include a lack of knowledge about or failure to recognize the signs and symptoms of a heart attack, being in denial or having fear about that potentially life-threatening condition, or concerns about feeling foolish or embarrassed for seeking advanced medical care for a false alarm if they weren't actually experiencing signs of a heart attack. Overall, it's important to call 911 or the designated emergency number immediately if you think that someone is having signs and symptoms of a heart attack. So, in general, what do you do if someone is having a heart attack? Like I said before, call 911. That is step number 1. Also, be prepared to give CPR and use an AED if the person becomes unresponsive and stops breathing normally. That is something that could potentially happen if someone is experiencing a heart attack. Help that person to rest in a comfortable position and loosen any tight clothing. If they're wearing, a tie and a nice shirt, loosen that tie and button the first few buttons of the shirt. Remove any clothing that is very tight, especially in their chest area. Many people often find it easier to breathe when sitting as well, so put them in that sitting, comfortable, resting position. If that person takes a prescribed medication for chest pain like nitroglycerin, offer to get the medication for the person and assist them with taking it. It is also important to reassure that person and monitor their condition until EMS personnel arrive and take over. Cardiac arrest occurs when the heart stops beating or beats too ineffectively to circulate blood to the brain and other vital organs. Cardiac arrest frequently happens suddenly without any signs or symptoms. So unlike a heart attack that has all those signs and symptoms leading up to a heart attack, cardiac arrest does not have any signs and symptoms. It is very sudden. It can also occur as a result of cardiovascular disease, breathing emergencies like drowning and choking, severe trauma, electronic shock, or drug overdose. In children and infants, the most common causes of cardiac arrest are breathing emergencies, chest trauma, and congenital heart disease. Cardiac arrest is not the same as a heart attack. Although a heart attack can lead to cardiac arrest, the two conditions are very different. Remember that a heart attack occurs when blood flow to part of the heart muscle is blocked, causing part of the heart muscle to die. On the other hand, cardiac arrest occurs when the heart stops beating suddenly or unexpectedly or beats too ineffectively to circulate blood to the brain and other vital organs. So another way of thinking about this is cardiac arrest is an electrical problem. It occurs when the heart malfunctions and stops beating unexpectedly, whereas a heart attack is very much a plumbing problem. It occurs in the circulatory system when blood flow to the heart is blocked. A person in cardiac arrest is typically also not responsive, not breathing, and has no heartbeat. A person having a heart attack is typically conscious and often experiences symptoms like shortness of breath or that pain or tightness in the chest. Although it is important to remember that a heart attack can trigger cardiac arrest. When responding to cardiac emergencies, it's important to follow the cardiac chain of survival, which consists of 5 actions that, when taken, increase a person's chance of surviving cardiac arrest. Each link in the chain depends on and is connected to the other links, and each minute that CPR and defibrillation are delayed reduces the chance of survival by about 10%. As a trained lay responder, you are the first link in the cardiac chain of survival. 4 out of 5 every cardiac arrests in the United States happen outside of the hospital. By completing the first 3 links in that cardiac chain of survival, which includes early access to care or calling 911, early CPR, and early defibrillation, responders can make the difference between life and death for a person in cardiac arrest. While not occurring in the heart, stroke is also considered a cardiac event. A stroke occurs when the blood supply to the part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. As a result, brain cells begin to die within minutes. A stroke is a medical emergency and prompt treatment is crucial. In other words, early action can reduce brain damage and other complications, so time is a major factor in the treatment of stroke. The good news is that fewer Americans die of stroke now than they did in the past as a result of faster treatment. Effective treatments can also help prevent disability from stroke. There are 2 main causes of stroke: a blocked artery, which is also known as an ischemic stroke, and a leaking or bursting of blood vessels, which is known as a hemorrhagic stroke. An ischemic stroke is the most common type of stroke. It happens when the brain's blood vessels become narrowed or blocked, causing severely reduced blood flow, also known as ischemia. Blocked or narrowed blood vessels are caused by fatty deposits, similar to that when someone experiences a heart attack, or by blood clots or other debris that have traveled through the bloodstream and lodged in the blood vessels in the brain. Hemorrhagic stroke occurs when a blood vessel in your brain leaks or ruptures and can result from many conditions that affect your blood vessels, including uncontrolled high blood pressure, overtreatment with blood thinners or anticoagulants, bulges at weak spots in your blood vessel walls, also known as aneurysms, trauma like a car accident, protein deposits in blood vessel walls that lead to weakness in the vessel wall, and an ischemic stroke leading to a hemorrhage. There are a few different warning signs or symptoms of stroke. This includes weakness or numbness of the face, arm, or leg on one side of the body, loss of vision or dimming like a curtain falling in one or both eyes, loss of speech, difficulty talking or understanding what others are saying, a sudden severe headache with no known cause, and loss of balance or unstable walking. If somebody is experiencing these symptoms or you notice these symptoms in another person, it is important to seek medical attention right away. Think fast and do the following. We use the acronym FAST for face, arm, speech, and time. So face, ask the person to smile. Does one side of their face droop? With their arms, ask the person to raise both arms. Does one arm drift downwards or is one arm unable to rise? With speech, ask that person to repeat a simple phrase. Is their speech slurred or strange? And then lastly, time. If you observe any of those signs, call 911 immediately. The faster response time for a stroke matters. The faster someone can respond to a stroke and EMS personnel can get to that individual experiencing a stroke, the fewer or the less brain damage and disability they'll experience. So if you do see someone experiencing a stroke, not only call 911 right away, but stay with that person and monitor them carefully while waiting for that emergency assistance. This is the end of the lesson on heart attack, cardiac arrest, and stroke. Please go to the First Aid, CPR, and AED folder and take the quiz.